Autism Spectrum Disorder, ASD, is a neurodevelopmental disorder characterized by persistent deficits in social communication and interaction, as well as restricted, repetitive patterns of behavior, interests, or activities. ASD encompasses a wide range of symptoms and severity levels, leading to the term spectrum. It affects individuals differently, with some people requiring significant support while others may have fewer challenges. Here are some key points about autism spectrum disorder. Social communication deficits. Individuals with ASD often have difficulty with social interaction and communication skills. This can include challenges in understanding and using verbal and nonverbal communication, difficulty in maintaining conversations, and difficulty understanding social cues and norms. Restricted and repetitive behaviors. People with ASD may engage in repetitive behaviors or have restricted interests. This can include repetitive movements, e.g., hand flapping, rocking, insistence on sameness or routines, intense interests in specific topics, and sensory sensitivities, e.g., to light, sound, texture. Early onset. Symptoms of ASD typically emerge in early childhood, although they may not become fully apparent until later in life. Many parents and caregivers notice developmental differences in their children by the age of 2 or 3, such as delayed speech or lack of social interaction. Diagnosis. Diagnosis of ASD is based on clinical observation, developmental history, and standardized assessments. The diagnostic criteria are outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or other diagnostic guidelines. Causes. The exact causes of ASD are not fully understood, but research suggests that a combination of genetic, environmental, and neurological factors may contribute to its development. There is no single cause of ASD, and it likely involves a complex interplay of genetic and environmental influences. Treatment and interventions. While there is no cure for ASD, early intervention and appropriate support services can help individuals with ASD improve their skills and quality of life. Treatment may include behavioral therapy, speech and language therapy, occupational therapy, social skills training, and educational interventions tailored to the individual's needs. Lifespan considerations. ASD is a lifelong condition, but symptoms and challenges may change over time. With appropriate support and interventions, many individuals with ASD can learn to navigate social situations, develop relationships, and lead fulfilling lives. Transition planning is important as individuals with ASD transition from childhood to adulthood, with a focus on developing skills for independence, employment, and community participation. It's important to recognize the strengths and abilities of individuals with ASD and to provide support and accommodations that promote their inclusion, dignity, and well-being. Early identification and intervention are crucial for maximizing outcomes and helping individuals with ASD reach their full potential.